Hi everyone, welcome back to my channel. This is Dr. Diana Castleman. I'm an naturopathic doctor and Menopause Society certified practitioner practicing here in Ontario, Canada. Today we're going to be touching on the most frequently asked questions I get surrounding menopause hormone therapy. I receive such wonderful questions from my patients every single day in my practice, and I thought I'd compile them all together and answer them for you today. So let's get started. This is a reminder that the information in this video does not substitute for professional medical advice. So the first question I've received is, can I take menopause hormone therapy if I have a history of endometriosis? So what we do know about endometriosis is that it is hormone dependent. And what we mean by this is that the growth and progression of endometriosis is influenced by estrogen and progesterone. Now we know it's not the only thing at play. Endometriosis is quite complex. For example, we also know that the immune system is involved. And a lot of people actually do a lot better when they use something like an oral contraceptive pill to manage their endometriosis symptoms. It can make the period pain a lot better. It can reduce heavy bleeding. And so we know that it is a management strategy. So where does menopause hormone therapy come into play here? We know that it's very different to the oral birth control pill. It doesn't cause ovarian suppression. The actual research around menopause hormone therapy and endometriosis is really quite sparse. The current evidence tells us that even if, let's say, you've had surgery to remove your uterus, you still want to use progesterone. Now, the main reason we would use progesterone as part of menopause hormone therapy is to protect the endometrial lining. If you have a uterus and you take estrogen on its own, it can proliferate that uterine lining and put you at risk of endometrial cancer, which obviously we don't want. Now, the difference here is that if you've had your uterus removed, technically we don't have to use a progesterone, but it is still recommended if you've had a history of endometriosis. And the main reason for this is that there can still be microscopic lesions that are left over after surgery. Okay, so that is the main reason that you still want to be taking progesterone even if you don't have a uterus any longer. The other factor that we consider is that if we give you estrogen with no progesterone, you can have an increase in pain symptoms. Okay, so that's another thing to keep in mind, is that with an increase in estrogen, women can have an increase in pelvic pain again. So this is where an informed consent conversation with your healthcare provider will be really important. It will also depend on what your symptoms are. So let's say you are experiencing hot flashes and night sweats. Maybe you'll start with a progesterone first before adding in estrogen if estrogen is giving you those kinds of symptoms like pelvic pain. There's ways that we can get around this. And of course, there's also non-hormonal options. There is no right or wrong answer here. It's a nuanced discussion with your provider, but it can definitely be added as part of your treatment plan, even if you have a history of endometriosis. And now on to question number 2. Can I take menopause hormone therapy if I have migraines with aura? For context, migraines with aura, and that aura specifically refers to the neurological changes that can occur before a headache or even during. So they can be things like visual disturbances, flashing lights, and it can really impact someone's quality of life. Now, the impact of hormone therapy on migraines can be very unpredictable. Oral estrogen has been associated with more frequent and more severe migraines, as well as higher analgesic use compared to transdermal estrogen, meaning estrogen on the skin, like in the form of a patch or a gel. So transdermal estrogen can maintain more consistent estrogen levels and is less likely to exacerbate a migraine. So the typical recommendation is to use a non-oral estrogen first that controls symptoms. And a trial can always be done with your healthcare provider to see, of course, how you respond. Okay, question number 3. Will I gain weight if I take menopause hormone therapy? The answer is no. You do not have to be worried about weight gain. Menopause hormone therapy is actually weight neutral and has not been shown to increase any sort of visceral adiposity or increased weight. Now, hormone therapy can actually indirectly benefit your weight or your weight goals if it helps you feel better, right? So if it is now treating a lot of your symptoms, you are sleeping better, your hot flashes, night sweats are gone. Of course, you're now going to be more inclined to do things like exercise, meal prep, all the things that we know that can help with weight loss. So this is where my patients can see that indirect benefit from being on menopause hormone therapy. Now, something I also want to note here is that within the first 3 months of being on hormone therapy, this is also when side effects are most likely. Some of my patients will report that they feel quote unquote heavier, and this can come from that fluid retention that can actually happen with both estrogen and progesterone. So my number one recommendation here, if you do experience this, of course, talk to your provider. It might be mild and you can kind of push through it because it does go away over time, but this is not, again, weight gain. It tends to be more of that fluid retention that can happen as you initiate hormone therapy. Okay, question number 4. I'm currently postmenopausal, recently started hormone therapy, and I've had some bleeding. Is this considered normal? So unexpected vaginal bleeding is actually very common. It's one of the top 3 sort of side effects that we see on hormone therapy. And this sort of breakthrough bleeding that can occur, it can occur in up to 40% of women in the first 3 to 6 months when they initiate hormone therapy. Now, of course, you want to inform your provider about this, but they might not necessarily refer you for, let's say, a transvaginal ultrasound right away in the first 3 months, because like I said, it can be quite common. Bleeding that lasts after 6 months, that is quite uncommon and should definitely be investigated, and important that you alert your provider right away. Now, another point I want to make here is making sure that the dose of progesterone you are on matches your estrogen dose. So for example, let's say you're on an estrogen patch, a 75 to 100 microgram patch, and you're on 100 milligrams of progesterone, of oral micronized progesterone. That might not be enough to protect the endometrial lining. And so often what our first step is increasing that progesterone dose to make sure that, again, it matches your estrogen dose that you're on. If you're on a 37.5 microgram or 50 microgram patch, 100 milligram progesterone should be enough adequate protection for that endometrial lining. So when in doubt, of course, check in with your healthcare provider and just ask them, is my dose appropriate for what I should be on for both of these hormones? And they will be able to guide you through that. Okay, question number 5 is, how long does it take menopause hormone therapy to work? So we can take up to 3 months to see the full symptom benefit of menopause hormone therapy. I always recommend to my patients that we shouldn't change the dose, the route of administration, or even the product before the 3 months is up. After the 12 weeks, we can reassess, see where you're at. I'm typically looking for about an 80 to 90% symptom improvement in my patients. And so if we feel like a lot of their symptoms are hormone related and we're not there yet, that's when we can make those dose adjustments. Okay, so question number 6 is, how long can I stay on menopause hormone therapy? So we're recording this video in 2025 and we've had updated evidence. The current guidelines suggest that there is actually no definitive age cutoff for menopause hormone therapy. If your provider is saying you're 60 or 65, you have to come off your hormones now, that's actually not true. It's a careful consideration, again, weighing the benefits versus the risk. And so you can really only do this with your healthcare provider who knows your entire health history. And what we look at are things like your blood work. We look at your blood pressure, right? Your whole cardiovascular picture. Has that changed at all? We look to see if you've had any other screenings that tell us maybe you shouldn't be on this anymore. So again, we're weighing the benefits versus the risk longer term, but you most certainly can stay on it much longer than 60 years of age. As previously, a lot of people were informed to just be on it for the shortest period of time, and we know that that's no longer the case. And the final question for today's video is, can I take menopause hormone therapy if I have fibroids? So the short answer to this question is yes. Having a history of fibroids is not a contraindication to menopause hormone therapy. So as our estrogen and progesterone declines in menopause, so will the size of our fibroids. Both estrogen and progesterone can influence fibroids. And therefore, in perimenopause, when our hormones are changing all the time, the impact of these hormones on the fibroids can be a little bit unpredictable. Depending on the size of your fibroid, you can talk to your healthcare provider about setting a schedule of checking in on them through a transvaginal ultrasound. So maybe you say, can we check on it once a year to make sure everything is still okay and moving in the right direction? Additionally, what we can do is use the lowest effective dose for you of menopause hormone therapy to make sure we don't contribute too much to the growth of the fibroids. Now, the good news is that for the majority of the studies that have been done, menopause hormone therapy has not been shown to affect the size of uterine fibroids to a significant degree in menopausal women. So that is definitely reassuring. I hope you enjoyed today's video. Please like and consider subscribing. It really helps support me create future videos like this. And if you have any further questions about menopause hormone therapy, drop them below and I'll make sure to cover them in a future video. For more content like this and to be a part of a community of like-minded women, please consider subscribing to my newsletter, which I'm going to link below. It's called The Informed Woman, and I send it out every single Tuesday at 7 a.m. Eastern Standard Time. I really hope you'd consider joining us there.